Meclizine is an antihistamine used to prevent and treat nausea, vomiting, and dizziness caused by motion sickness. It may also be used to reduce dizziness and loss of balance, vertigo, caused by inner ear problems. It is typically taken once a day, with or without food. It is best to take it at the same time each day. The usual adult dose is 25 to 50 milligrams once a day. When taking Dramamine less drowsy, it's important to follow the directions on the package. If your doctor has prescribed it, be sure to take it as directed. If you have any questions, don't hesitate to ask your doctor or pharmacist. You can take this medication with or without food, and if you're using the chewable tablets, be sure to chew them thoroughly before swallowing. The dosage will depend on your medical condition and how you respond to the treatment. It's important not to increase your dose or take the medication more frequently than directed. If you're using Dramamine less drowsy to prevent motion sickness, it's recommended to take the first dose about an hour before you start the activity, such as traveling. If your condition doesn't improve or gets worse, be sure to let your doctor know. If you experience drowsiness, dry mouth, or tiredness, it is important to notify your doctor or pharmacist if these effects persist or worsen. To relieve dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. If your doctor has prescribed this medication for you, they have determined that the benefit outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. Be sure to contact your doctor immediately if you experience any serious side effects, such as changes in mental or mood, fast or irregular heartbeat, shaking, or difficulty urinating. Seek medical help right away if you have any very serious side effects, including seizures. While it is rare, a serious allergic reaction to this drug can occur. Contact medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not mentioned, be sure to consult your doctor or pharmacist. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Meclizine, make sure to inform your doctor or pharmacist if you have any allergies, as this product may contain inactive ingredients that could cause allergic reactions or other issues. Also, it's important to discuss your medical history, especially if you have breathing problems, high pressure in the eye, heart problems, high blood pressure, seizures, stomach/intestine problems, overactive thyroid, difficulty urinating, liver problems, or kidney problems. Keep in mind that this medication may cause drowsiness, and using alcohol or marijuana can intensify this effect. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Also, be sure to avoid alcoholic beverages and talk to your doctor if you use marijuana. If you have surgery planned, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that children may be more sensitive to the side effects of this drug, and it can cause excitement in young children instead of drowsiness. Older adults may also be more sensitive to the side effects, particularly drowsiness, confusion, or trouble urinating, which can increase the risk of falling. If you are pregnant, this medication should only be used when clearly needed, and it's essential to discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding to determine if this drug passes into breast milk. It's important to be aware of potential drug interactions, as they can affect how your medications work and increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Dramamine less drowsy include antihistamines applied to the skin, such as diphenhydramine cream, ointment, or spray. It's also important to let your doctor or pharmacist know if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Check the labels on all your medicines, as they may contain ingredients that cause drowsiness. It's best to ask your pharmacist about using those products safely. Additionally, this medication may interfere with certain lab tests, so make sure lab personnel and all your doctors are aware that you use this drug. If someone has taken too much Dramamine less drowsy and has serious symptoms like passing out or trouble breathing, you should call 911 immediately. Otherwise, call a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include severe drowsiness, seizures, and widened pupils. In children, mental or mood changes such as restlessness, irritability, and hallucinations may occur before drowsiness. Make sure to follow up with your doctor regularly and attend any scheduled medical or laboratory appointments. This will help to ensure that you are receiving the proper care and monitoring for your condition. If you forget to take a dose, take it as soon as you remember. If it's close to your next dose, just skip the missed one and take the next dose at your regular time. Don't take double the dose to make up for the missed one. When it comes to storing Dramamine less drowsy, make sure to keep it at room temperature, away from light and moisture. It's important to keep it in a place that's not the bathroom and out of reach of children and pets. If you no longer need the medication or it's expired, be sure to dispose of it properly. You can ask your pharmacist or local waste disposal company for guidance on the best way to do this. Remember not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.